One of the most compelling things that sets Burrell students apart from other students is their rich foundation in osteopathic principles and practice, as well as a very well-rounded education, not just in the facts of medicine, but also its philosophy and application.
The kinds of procedures that students get when they rotate with me include carotid surgery, endarterectomy or stenting, thoracic aorta aneurysm repair with stent grafts, aortic aneurysm repair open or with stent grafts, a lot of peripheral arterial work in the lower extremities, bypasses or stents and angioplasty, amputations of the lower extremities as well. We do a lot of fistula work for patients who are on hemodialysis, and we do some venous work as well.
So throughout my rotations here in the Albuquerque hub, I've been pleasantly surprised at how welcoming all members of staff have been, from nurses to physicians. Everybody's willing to teach you and make sure that you're a very competent physician.
I rotated with a neurosurgeon, great preceptor, and our first brain surgery, which I was really excited about, actually ended up being a multiple myeloma in the patient's skull, which we did not expect. We just thought it was, a meningioma that kind of, grew rampant. But that was a really cool experience because that's not something that's seen often.
When students rotate with me here in the clinic, we learn about our patients together. We interview them and come to understand how a person has come to live the life that they're living. And most importantly, we work together to find that patient's strengths and help that patient find hope wherever they can find it.
Day one of my OB rotation, we received a call to go and perform a C-section. It was a scheduled C-section, and I found myself in the operating room. I'd never witnessed physically a childbirth, and it was such a magical moment, very beautiful. My job was to hold a retractor, but I was so distracted because this little boy was so cute.
I think what matters is the motivation, the drive that they have, and I see that in their eyes, and I hear it in their voices, and they really try hard. And what's I think really cool is that it's a one-to-one interaction with an attending for 30 days, with my team, of course, right? But I think that makes it really cool for them because they get to see how a very busy vascular service with very sick patients works.
I was frequently looked to for any suggestions or advice I would have about the patient care, whether that be during the stay or transitioning to rehab facilities afterwards and things like that. Even the notes that I was writing for patients, which really I thought only my preceptors were reading, were actually being read by the entire staff. And I've had staff approach me and ask me about some of the things I wrote in there and how I felt about the patient care. So that was very interesting. It felt so good to be a doctor.
I would like to express my gratitude to Burrell College for granting me this opportunity, for seeing faith in me and letting me come in as a student to help me become a great physician. I'll forever be grateful.